Hello, this is Ms. Hammonds. This video is a presentation of Chapter 9. We'll be looking at articulations, also referred to as joints. In this chapter, we will discuss the definition of the term articulation. So, articulation is the site where two or more bones meet. Articulation gives the skeletal system its mobility. It also is the portion where the skeletal system is held together. It is the weakest part of the skeletal system, again, because it's the site where two or more bones are held together, specifically by fatigued. All right, so looking at classifications of joints, we're going to be looking at two types or two classifications, structurally and functionally. We're going to start with structural classifications first. Structural classification focuses on the material that binds together and whether or not there's a joint cavity present. So the three structural categories of joint classification, first are fibrous, second is cartilaginous, third is synovial. So fibrous structural classification are bones that are united by a fibrous connective tissue. Cartilaginous bones are joined by either a hyaline or a fibrocartilage. And then synovial bones are not directly connected, however, but they are united through a fluid-filled cavity. The majority of the joints that we will be looking at will have a joint synovial cavity. This is the most common type of joints that we will find. Joints that are classified by their functionality are listed here. They are classified as synarthrosis and free arthrosis or diarthrosis. Those that are synarthritic, I didn't identify what the functional classification is based on. So functional classification is based on the amount of movement that is allowed at this joint location. Synarthrosis or synarthritic joints are immovable or are nearly so. They have almost no mobility. And free arthrosis have very limited mobility. And diarthritic or diarthrosis are those that are able to move freely. Just below that category, you see we have uniaxial, biaxial, and multi-axial. The planes or the number of planes that are available for the movement are also listed below. So uniaxial have movement on one plane. They can bend or straighten. An example would be the elbow. Biaxial would be movement on two planes. Your metacarpals, your phalanges would be an example of that. Multi-axial would be movement on multiple planes. The examples that are provided are the shoulders and the hip. Now we're going to look specifically at the structural categories, giving you more specific details. So fibrous joints. These are bones that are connected directly with fibrous connective tissue. Again, there is no joint cavity located at this particular type of joint location. These are all located adjacent at a directly to the connective tissue and that bone. Sutures are examples. They are bound tightly, and there's a synarthritic type of joint located at that place. Syndesmosis is a fastening. There's a parallel connection between these bones. and gomphosis, where there's a fastening of a bolt-like peg in a socket type of connection between these. So in this first diagram A, it shows you an example of a dense fibrous connective suture-like for the first type of example for synarthritic. Second, you have the syndesmosis present between the ulna and the radius. And then the third example for C is the gomphosis or peg and socket of a synarthritic type of joint located in the gums. The next type of joint in our structural category is the cartilaginous joints. Again, these bones are united by either a hyaline or a fibrocartilage type of joint. Again, there is no joint cavity present. The synchondrosis type of joint is either temporary or permanent. Here, you'll see the presence of an epiphyseal plate where the hyaline cartilage is being produced. Remember, this is present during the puberty period, where young people go through their growth spurts. Once adulthood has been met, this will become closed off, the growth will end, and that plate will harden. Here, where you have your pubic symphysis, again, that would be a symphysis plate that would not continue to grow, but it would provide mobility in this particular area. The next one that would fall under our structural category are the synovial joints. So several parts of the synovial type of joint have been identified in this image. You have your articular capsule, which is located here, which is what forms the joint cavity. The articular cartilage, which can be hyaline cartilage, covers the articular surfaces of the bones. It is not necessarily a continuous structure, but it does have a particular location that's located on the top surfaces of the bones. The synovial membrane is an interior lining of that particular capsule, and then located inside is a viscous lubricating fluid that provides nutrient to that capsule, excuse me, which is your synovial membrane. And then all synovial joints are usually located in diarthrosis types of joints where there is free mobility. So some additional synovial joint structures. You will have extrinsic, intrinsic, and intracapsular structures where you have your fatty pads, the bursa, and some additional ligaments. These are all structures that support the movement, the free movement of those structures. You'll have greater mobility, again, in the locations where you have your synovial joint structures. Bursitis is a type of inflammation that can occur in the locations where you have the synovial joints. You may have pain, swelling, and stiffness. It can be acute or it can be chronic. It will be caused due to overuse. It can be caused by trauma or an excessive pressure. Those who suffer from rheumatoid arthritis or some type of gout or an infection, some treatments or from corticoid steroids can be used, or some of the NSAIDs would be used to treat those. And then the diagrams off to the left would show you where some of these different types of bursitis could occur. There are different types of synovial joints, and the diagram off to the far right It shows you the locations of where a variety of synovial joints would be located. Starting in alphabetical order, you'll have a pivot synovial joint. With the pivots, you'll have rotation around an axis, usually a uniaxial. So that means that it would only be able to go in a pivot right to left. With your hinge axis, the example given was the elbow. So the rotation is limited, bending and straightening about that single axis. In a condyloid, you would have shallow depression, which will articulate within around in a biaxial range. Your C is a saddle joint. You'll be able to articulate in a concave or a convex surface, still a biaxial. You'll have your ball and socket that would be able to articulate in a multi-axial surface. Your ball and axle will be located in your hips and in your shoulders. The condyloid and the plane joints would work similar to where you have your more range of motion, like with the carpals and the wrist. Moving on. All right, so when we talked about the bursitis, some of the inflammation as far as the swelling, the stiffness would be similar as far as joints where you have the arthritis to occur. Reducing mobility, the pain that will occur will also be present. Different types of gout. You can also have these to occur in your toes, your knees, and ankles. Some of these can be associated with the autoimmune diseases, such as the rheumatoid arthritis, systemic lupus. Some of the other things you would need to be familiar with would be some of the types of body movements. Synovial joints do allow you to have specific types of movements such as flexion, extensions, pronation, and supination. You have a list of these provided for you in your notes. Not really sure which exact page that is on. Oh, page 7. So I've provided you with a list of some of the prominent ranges of motions that you should be familiar with. Some of the ones I would be most familiar with would be flexion, extension, abduction, and adduction, eversion, pronation, supination. All of them are important to know. Those are the ones that stand out to me. Greater ranges of motion and greater instability. Movements are always described in relation to the anatomical position. So some of your synovial joints are classified based on location and the movements that they will allow you to provide. So I went ahead and I kind of selected some specific joints that are provided in our presentation. So the one here on the left is the atlantoaxial joint, which is located between the dens of the axis and the anterior arch. So this particular joint allows us to move our head left and right, and to nod your head up and down, or to nod your head yes, to shake your head no. The temporomandibular joint, which is located between the temporal bone and the mandibular condyle. My little stop sharing thing is kind of blocking that off. And the synovial 2 joints, I selected the glenohumeral joints, which is supported by a variety of ligaments and the rotator cuff. It has the wider range of motion. This is also located or identified as a ball and socket joint. You have an array of tendons and sheaths that are located here. Again, the synovial joints have the joint cavity that's associated with it. You also have your humeral ulnar joint, which also allows for an array of different types of flexions and extensions of the forearm. Here, you have a multi-axial hip joint that provides stability in a wide range of motion. And the diagram to the far right, you have, I think this is an MRI or an X-ray, where you have a hip fraction that has occurred and you're able to see where the screws and bolts have been implanted to provide support after surgery. In the synovial joints and this particular structure, this may be a supportive image to look at for those of you who also are enrolled in lab, where you're able to identify an array of the different ligaments that support the knee joints and the synovial cavities that are associated with it. So in this image, you have the taliocrucial joint that allows for the dorsal flexion, plantar flexions, and the eversion and inversion movements that are associated with your ankle. All right, and then that is the end of the presentation. So for joints and articulations, for your lecture course, there's not a whole lot of information that is going to be brought to you. However, in your lab courses, you will have to be a little more familiar with some of the structures. Just making sure that you're familiar with the different movements, again, that I've provided you a list of on your page 7 of your lecture notes. All right, guys, have a great day.